RX newsletter readers. Thanks for clicking through on the link. I'm Andrew Roesler. I'm a musculoskeletal therapist and also, the founder of SA Integrated Therapies, or SAIT as we know it. We are a collective of allied health professionals, physio, podiatry, Chinese medicine, nutrition, dietetics, myotherapy. I'm sure I've forgotten something, yoga. There's plenty of things that we do here, and we work as a genuine team to get people the best results. If we can't help them, we want to work with the wider community of fantastic people out there that's available to us here in Adelaide and beyond. So thanks for listening in. This is just a short session to get these videos going on a little bit of an education. And we sort of went with one of the things I see that's very prevalent in the cycling community. However, this is for everyone. This is not just cyclists. This is your average, everyday person will deal with these problems. And it's basically neck and shoulder pain, okay? And really this session it's just a little short education one. There is a video to follow that will show you what I do to treat this, just one part of what I do. There are plenty of other things, but it just gives you a little bit of an insight as to, what's available for you guys out there if you want to get this treated. Now, this is very simple, what I'm about to go through. I can complicate the hell out of this. However, that's not going to interest you. So we're going to get to the point and talk about it. You can Google doctor it. You can do whatever you like with this information. You can hit us up at the clinic. We absolutely love and encourage people to ask us questions. There's no obligation. We just want to give you some feedback or information that you can take away that's going to make you make more educated decisions on your own health. So what we're going to talk about is two main muscles that cause a lot of neck pain for cyclists. And the main reason is that cycling, not so much when you're sitting up on a mountain bike or maybe a more of a commuting bike, but certainly when you're down on your bars doing a decent climb or you're powering along on a time trial or something. But when you're down there, your head's got to be there. Okay, that loads the back of your neck, it impinges it. It's a really uncomfortable position. And unfortunately, if you're a cyclist, or one of the other things that I love is surfing and you're paddling on a surfboard, your head is going to get stuck in that position. And it's going to load the cervical vertebra and the muscles that connect in and around that. Two of the biggest culprits of causing you pain there are the levator scapula and the trapezius. Now the levator scapula, that connects to the four top vertebrae here in your neck, comes down onto the top corner of your shoulder blade. Its job is to elevate your shoulder blade, as the name suggests, and also to turn your head from side to side. Now I'm sure there's plenty of people here that can go, that'll be able to tell me that they've woken up at some stage and not been able to turn their head from one side to the other. This is your culprit. It's called a wry neck. It basically locks up, it spasms in this point right here, and it makes life hell. Levator scapula is your culprit. It causes pain right through here, sometimes back down the shoulder blade here, and even down the back of the arm. That is an absolute must when it comes to neck, shoulder pain. The other one is the one that sits over the top. We all know the traps. It's the one where someone comes in from behind you, grabs your neck, gives you a little massage, feels sort of awesome, also feels bloody painful. The trap is a bigger, broader muscle. It comes off the base of your skull, out to the point of your shoulder, all the way back down here to your nearly lower back, okay? That's got huge amounts of function, from raising the shoulders to retracting to dip. Fibers go everywhere. But if we just look at this top section, it also causes a lot of pain up through the side of the neck here. It causes pain down through here, point of the shoulder, and it can cause masses of headaches, which is a huge one for office workers, but basically anyone in life. And those headaches can be at the base of the skull, temple, eyes. So trapezius is one that must be looked at. So two muscles to keep in mind. When you've got neck pain, think about levator scapula, trapezius muscle. If you have them treated well, it's going to give you huge relief. Now, for me, that's one part of the equation to help with the symptoms. All right, that just wins you over. But if we want to get to this at a bigger level or a deeper level, we need to look at the front of the neck. I'm not going to go into it here, I'm not going to complicate it, but the front of the neck is hugely involved with these things, often because we sit there and our heads go forward, whether it's on the bike, whether it's sitting at the couch, whether it's behind the computer. And the problem is that this is 4 to 5 kilos away, this noggin of ours, sitting on this flimsy little structure. these muscles are working their butt off. And if your head, we've got tug of war going between the front and the back, which most of us do, we need to look at both. The other thing is whether one shoulder is sitting higher, lower, however you want to look at it than the other. That's a complicated process to look into, but that's something we also need to take into account, because one side can be getting what we call eccentrically loaded or in a constant stretch, and the other one can be concentric or contracted. They're all things that we need to look at. It gets super complex, but if we address those, we're going to go a long way to helping you with your discomfort. So the great thing is, generally, we can help you massively. The bad thing is, if you love cycling, if you love surfing, if you're going to spend a lot of time behind the computer or your steering wheel or on the couch, you will end up, in most cases, unless you're one of those freaks that can get away with it, with some neck pain, some discomfort, some headaches, whatever. It's not the end of the world. It can be treated, but you know, at the end of the day, it is quite debilitating and affects a lot of people. So hit us up. Hit your physio up, your chiro up, your massage therapist, someone, they've seen this stuff a million times, they'll be able to help you out. Hopefully there's some good information there. I'm going to show you a couple close-ups after this video of the levator scapula and the trapezius, just so you can picture them in close-up form. But yeah, any questions, anything you've got at all, please hit us up. We're going to gradually go into a lot more things with these videos. We're going to talk about performance, we're going to look at nutrition, we're going to look at all sorts of tips and tricks, not for just the bike, but also for life, because what I'm teaching you here, or what I'm going through here, or what we go through as a group, is not just for maybe you guys, it could be for your wife, your husband, your girlfriend, your boyfriend, your mum, your dad, your grandma, your grandpa. All of us are affected by most of the things that we're going to go through. We will definitely do some specific cycling stuff. And the more questions you have, the more you can point us in that direction, the better we can, I guess, make it more specific to what you guys are looking for. So please, let's make this a really open sort of, I guess, forum for you guys to ask stuff of us, because I think when you ask us a question, there's probably another, who knows how many people on the Bicycle Express database that would be interested in what you have to ask. So yeah, thank you very much for listening in, and I look forward to, and the team looks forward to, providing you with some really good ongoing information. So for now, thank you. Bye. So here we have the levator scapula coming off of the top corner of the shoulder blade, then connecting into the four top cervical vertebrae of the neck. The interesting thing about this muscle, see here, this is a great illustration, not all of them show this, but there's a twist in the muscle right here. And being on the right hand side, what happens is as the muscle contracts, that twist unfolds and turns the head around to the right. But that twist means it's a point of huge tension. And that's where we see that wry neck, or that jamming up of that neck that comes along with waking up in the morning and not being able to turn your head from one side to the other. So that point there is such a critical one to release. And you can see that because of the connection points into the vertebra, it feels like it's a joint problem, but the muscle actually pulls the joint, essentially, let's call it out. That's something that we often hear. It's not really pulling the joint out, it's just causing the whole lot to spasm. So that there, huge culprit. Probably even more so than the trapezius, but let me show you that now. And here's the trapezius. You can see, as I showed you before, on the skeleton, it connects from the base of the skull to the point of the shoulder, all the way across the shoulder blade, pretty much to your lower back, and right up either side of the spine. It covers a huge expanse of your back. It's involved with a lot of function of the shoulder girdle and the neck. You can see this by these different fibers, they run different ways. The levator scapular muscle sits deep to this, from about here right into those cervical vertebrae. When you're treating one, you're usually treating the other. So you're killing two birds with one stone. Sometimes they are misdiagnosed, but generally speaking, we'll hit both muscles no matter what. You can see here that these fibers are going to get pulled like a guy rope on a tent when your head goes forward, so when you're sitting in poor posture at the computer. Or on the other hand, you can see they're going to have to contract to extend your head back when you're on the bike, down on the bars, or in my case, when I love to go for a surf. So it's going to load this area no matter what, whether it's in a lengthened position or a contracted position. So the poor muscle cops it, and obviously can therefore cause a lot of pain.